The production of this program is made possible thanks to the support of the following and viewers like you. In the book, Why Good Things Happen to Good People, Stephen Post writes that giving to others has been shown to increase health benefits. And in a separate study by Michael Norton from the Harvard Business School, it revealed that people are much happier when they spend money on others versus themselves. Well, Megan Owen-Evans went far beyond the giving of money. She donated a kidney and part of her liver to 2 different anonymous recipients. Donating a kidney or a part of your liver is an enormous undertaking, says Owen-Evans. Not only do you need to take time off for the surgery and recovery, but you also undergo a plethora of tests that consume vast amounts of time. Time that takes the donor away from work and family. The cost in lost salary is significant, says Owen-Evans. So, fully aware of the impact on donors, Owen-Evans set out to change the financial impact on those generous souls who give of themselves. As president of Neptune Terminals, Owen-Evans established a new policy, paid time off for donors. It's a concept that is gaining support from other major employers in BC, such as Beedie Development and the David Foster Foundation. I invited Megan Owen-Evans to join me for a conversation that matters about corporate giving that supports employees and offers the gift of life to people in desperate need. Megan, welcome.
Thank you, Stu. Appreciate it.
Let's start with your story. You became a donor to an anonymous recipient. What inspired you to be so generous?
When I was young, in elementary school, I had a good friend that was on dialysis, and I think it always stuck in my mind that if I had a family member or a friend that was in need, I would donate my kidney. Fortunately, I didn't end up in that situation. I had healthy friends and family, but when I went back to school to get my business degree, wrote a paper about organ donation, and through research of that, discovered I could anonymously donate. And I thought, you know what, I'm gonna step forward and see if I'm able to donate, and I was, and that was how it all began.
It's not an easy process. I know someone whose husband needed a new kidney, and she wanted to donate. Not that he was going to be a match, but she wanted to donate a kidney into the pool be in that pool of donors. And her motivation was that it would then benefit her husband somewhere down the line. Perfectly healthy. The number of tests that she went through was extensive. And ultimately they said, nope, you're not eligible to donate. And so it's a rigorous process that they go through to ensure that, one, you're doing it for the right reasons, and that you're going to be passing along an organ that will be a benefit to a recipient.
That's right. Yeah, it was very rigorous. My kidney donation was in 2013, so I think I started that testing process in 2012, and it took quite some time. To your point, they really do ensure that when they're going to perform surgery on a healthy person, that they're absolutely healthy and they have the best chance of a really good recovery. And on top of it, that organ is going to be in good shape for the person who's receiving it.
So in my intro, I made mention of the fact that there's all these tests that you go through. Well, that takes time. How much time do you think that you invested in becoming a donor?
Great question. For the kidney, it was fairly significant because it was spread out. So I was doing, a day here, a day there, and it was local. So it was less time intensive, I guess, because I could go to VGH or St. Paul's and get those tests done. It still was a number of days that I would have had to take off over the course of that time. But for my liver donation, it had to be performed in Toronto. So I actually had to fly to Toronto to get all the testing done. So of course I'm missing a few days. And they were really, really efficient in getting all that testing done, like right close together.
At the time, because now you're developing this program, how receptive was your employer to the idea that you're taking time off work to donate a part of your body to somebody else?
I was extremely fortunate. At the time I worked for Viterra, and they were very receptive to the fact that I was doing something good, and they said right off the bat, you know what, you do what you have to do, and we'll cover you when you're off work. But the circle of excellence that we'll talk about wasn't in play at that time. So had they not done that, I would have been out of pocket for wages for better part of 6 weeks.
So your experience and the support from your employer, this has motivated you to get behind the idea of not only encouraging other people to be donors, but to say to companies and organizations, it's our responsibility to get behind our team members who give so selflessly.
Absolutely. You know, back in 2013 when I donated, I wasn't in the same financial situation I am in now, and it would have been a burden to me had I not been covered by my employer. And so it's more than apparent to me, especially for people who have to travel out of province for this surgery, that it can be a significant barrier to living donation, and we need to remove those barriers if we want living donation to increase.
So how do you go about doing that? Like within a company to say, okay, I'm going to introduce this, because I'm sure that there'll be people who will watch this and go, okay, Megan, I hear what you're saying and I agree we should do this, but it's got to be something that you have to think your way through quite carefully.
Honestly, I actually consider it a bit of a no-brainer. It's a fairly simple policy that you write that's supplemental to, you know, other benefits that you have, and really the minimum threshold for inclusion in the Circle of Excellence, the Living Donor Circle of Excellence, is 80% coverage of salary for a minimum of 4 weeks. Neptune, Fiberco that I was with previously, and some others that BCMEA, GCT that have joined have gone beyond that and offered 100% of wage coverage for 6 months, which is in line with short-term disability. The chances, I think it's 14 people in a million that are living donors. The chances that you're ever going to pay this benefit are so slim. But if you do, I think most would agree that whether they had this policy or not, they would pay their employees wages for such a surgery. But it means that employees don't have to ask. It's inherent.
The production of this program is made possible thanks to the support of the following and viewers like you. How does this impact employees? Even if they're not going to be a donor or they don't think that they're going to be a donor, knowing that their employer cares so much about them and that you're supporting someone else who is in need, what kind of message are you sending throughout the organization about yourself as a company?
I think it just furthers, you know, Neptune's message overall to our employees is that we care. And, you know, there's a lot of people whose loved ones are struggling as recipients, for example. And it shows that we're promoting living donation and caring about our employees and willing to, I think it could open up into other avenues where if somebody has healthcare issues, they're going to be more likely to feel that they can talk to their employer in that situation.
What's the benefit to the company when you have employees that appreciate you as an employer so much?
I mean, people are everything, and our people we value highly, and I think we work hard to let them know that we do care genuinely. So when people feel cared about and valued, they feel like they're part of the equation, and it goes a long way to everybody feeling they have a purpose.
One of the things that I find quite interesting about what you're doing is it is a form of corporate giving. You know, so often we go, oh yeah, okay, well, we're going to take a certain portion of whatever budget we have and we're going to give it to this organization, or we'll give it to that one of them being maybe the Kidney Foundation. But in a way, you're donating through the support of your team members. And it's a really unique way of helping to support programs that need that kind of support.
Agreed, and it's definitely an initiative that I'm trying to get some legs behind on the waterfront. It's not typically been a waterfront initiative. A lot of healthcare, I would say, organizations had joined the circle, but it's gaining legs in the waterfront now, and I'm hoping people watch this and reach out to me, because I'm more than happy to talk about how they get included at any time.
Okay, you know, there's some people who are going to be watching going, on the waterfront, what does that mean?
Okay, so the waterfront is port terminals in Vancouver, essentially, but it can go well beyond that. There's sister companies. They're the parent company of Fiberco, where I previously worked. Tolco has joined the Circle of Excellence. Like I said, I think when people delve into what inclusion really means, it's a recognition program, but it provides this level of benefit to employees that is new and quite profound.
Hi everyone, my name's John Gill. I'm a kidney transplant doctor at St. Paul's Hospital in Vancouver. Every day I get to work with people who literally are giving of themselves to help others. And that's a very powerful thing. The fact that we're all linked is evident in the work that I do every day. Very simply, without a donor, there is no transplant. So why do we need living donors? Right now, there's 100,000 people waiting for a transplant in North America. Sadly, 20 of those people will die every day. We perform about 20,000 kidney transplants every year in Canada and the United States, and 6,000 of those kidneys that we transplant are provided by living donors. We think many more people could donate kidneys to help others, but there's barriers, and the main barrier is financial. The average donor needs about 4 weeks of time to recover after the donor surgery, and for most donors, that's an unfunded activity. The Living Donor Circle of Excellence is a program that's trying to correct that. The Living Donor Circle of Excellence is a corporate recognition program that celebrates companies that simply adopt a work leave policy that says, if we have an employee that's going to donate a kidney, we're there to cover their salary. The minimum requirements to be a member of the Circle of Excellence are to provide 4 weeks of salary support at 80% of the person's salary. 4 weeks of salary support is about $5,000 to $6,000 for the average employee. Importantly, this is going to be a rare event for your company. The living donor rate is only about 4 per 100,000, so you can become a member of the Circle of Excellence without any cost up front. In addition to providing financial support for your employees who choose to be a donor, this is really removing a stigma that's associated with donation. If you think about it, this is not like breaking your leg so you need time off of work. This is something you're choosing to do, and so people perceive that as perhaps showing a lack of commitment to the company or to their workplace. So making this explicit in your sick leave policy is really important beyond the financial support. There's also huge societal benefits to living donation that you're enabling by implementing this policy. We all know that our healthcare system is in trouble at the moment. Each kidney transplant that is done saves the healthcare system over $500,000 compared to treatment with dialysis. So I really hope that you'll consider joining the Circle of Excellence. It's a very powerful feeling when you know that you're helping heroes do their thing. Thanks for listening.
The production of this program is made possible thanks to the support of the following and viewers like you. You have gone even another step further. You've now joined the board, I understand, of the Kidney Foundation. What has motivated you to be so generous in your time and support of an organization like the Kidney Foundation?
I mean, the Kidney Foundation, I've been involved with it in various levels as far as like Kidney Gala volunteering for quite some time, but I see the great work they do, and they're very linked in with the Living Donor Circle of Excellence. And so when Pia Schindler reached out to ask me if I would consider being on the board, I was excited to participate. It's a small ask of my time, I feel, and I'd love to be able to help the direction of that organization. Well, let's tell viewers a bit more about the Kidney Foundation and why we want to encourage others to get behind them as well. I mean, the Kidney Foundation is a wealth of resources around kidney disease and how people living with kidney disease have access to different healthcare, et cetera. And the board is really aimed at guiding that organization forward to influence government, if need be, and shape what, I guess, I'm struggling with this, but to shape how people can access the resources that they need, that when they're struggling with kidney disease, that their families, what they might need to access, how somebody can go about living donation. There's, if you go to the Kidney Foundation website, and there's different branches, but the Canadian website really points you to, if you wish to be a kidney donor, how do you go about that? Links you to the Living Donor Circle of Excellence if you're an employer. There's many, many great resources available in that space.
So what kind of support does the Kidney Foundation then offer to people? Is there a research side that you're supporting? Is there a treatment side? And is there an information and support to the patient side of it?
I would say all of the above. I mean, it's got its hands in pretty much every area that a kidney patient might be in need. So always looking to develop and span into other areas, but certainly supportive of research. And like I said, sort of there's the direct benefits as far as transplant, as far as if you're a recipient, what access do you have to different healthcare or mental health, that kind of stuff. But in addition, these Circle of Excellence and programs that are supportive of that initiative on the back end.
What does a patient's journey look like? Somebody who is in need of a kidney, what does their day-to-day life look like?
It's a good question, and I've not lived it, but I think it can be pretty difficult depending on how far along they are in their kidney disease journey. Dialysis, I'm told, is not a pleasant experience and takes up a considerable amount of time. So once a kidney patient is at the stage where they're needing dialysis, I think it takes a great deal of time away from their ordinary life. And so they're waiting. It's a waiting game that they're on a list to see if they'll get a donor. And most of the time that would be a deceased donor. But I'm hoping that more and more we're going to see living donation on the increase.
It's quite an unusual thing, though, living donation.
I think it's becoming less unusual, Stu. I hope it is. I mean, 10 years ago, 11 years ago, when I donated my kidney, I think it was far more unusual. But there's a lot more people realizing that it's laparoscopic surgery. It's not as invasive as it once was. Your scars are minimal. And then I think liver donation is probably a little more unusual and less known. But the fact that the liver regenerates in 6 weeks is fascinating to me. And I think people just need to understand better what the process is, and more people might step up.
I'm Suzanne Skidmore. I am a living kidney donor, and I am the Secretary Treasurer of the BC Federation of Labour. And many years ago now, almost 10 I think, I donated a kidney to my cousin. And I was a bit concerned about, the financial impact of taking 6 to 8 weeks off of work, and the travel and hotels for myself and my partner, working as a BC government employee, having in my collective agreement language. I had a language in my agreement that allowed me as a kidney donor to be able to take the leave without any loss of pay through the Circle of Excellence. There's no reason employers couldn't do this and offer this up to their employees, whether they're unionized or not. It was an amazing, sort of opportunity for us to be able to just continue to get our paychecks and go through this process, which is quite onerous on your body and on your family, and very stressful time. And to not have to worry about money really just took the burden off of all of us.
The production of this program is made possible thanks to the support of the following and viewers like you. We know that there's a need for kidney donors, because people who are on this journey, I can't imagine how disruptive it is to their lives. Going in for dialysis, as you said, it's quite an arduous process. And the need is there for not only the treatment, but for donors. What I find so interesting about what you are doing as a company and what you're doing to encourage other people is what you call the Circle of Excellence. So how do you describe what this Circle of Excellence is?
Great question. It's a voluntary recognition program for employers, and it's a partnership between the American and Canadian Societies for Transplantation, an initiative from actually a UBC professor, Dr. John Gill, and it was aimed at reducing the financial barrier to living donation, which I think is one of the largest barriers to people becoming living donors. The way you go about it is you can go to the AST Living Donor Circle of Excellence website. It lays it out very easily, but it's as simple as creating a policy through your business that states that you will support the wage and benefit law or coverage for anybody who chooses to be a living donor at a minimum coverage of 80% of wage for a minimum of 4 weeks. But as I said, most people or businesses that I'm aware of have gone beyond that and said 100% coverage, and often for 4 to 6 months, in line with short-term disability coverage.
So when you went through the donation process, how many days in total do you think that you had to take off of work? And I ask this as a kind of an example for employers to look at and go, okay, what kind of commitment are we actually making here?
Yeah, I would say for my kidney donation, I took a month post-surgery, and I would say probably about between 5 and 6 weeks, including all the testing, etc. Liver donation would have been similar.
Yeah.
So as far as commitment for an employer, if you think about 6 weeks over somebody's annual salary, I don't know what median salaries are today. I think they've increased, but at a $60,000 salary, that's about $4,000 of coverage if you set the minimum of 4 weeks. It's a small.
Well, I guess one of the other things to factor in is that you're probably going to have a team member who remains committed to you as an organization because you supported them on this journey. So yes, you may look at it as being a commitment, a financial commitment in a certain block of time, but it's not something that's going to be happening year after year after year. This is it's probably, for the most people, it's going to be a one-time support.
Absolutely, and as I said before, with 14 people in a million donating as living donors, I think the chances of you having that occur once, let alone more than once, are pretty slim as an employer. But the thing I look at is you're more likely to have a recipient in your organization that's on, going through the medical system and frequently missing work. And by encouraging this kind of policy to exist in other employers, you might well find a donor for that recipient sooner, which gets your own employee back to work more quickly. So there's two ways of looking at it.
When you use this figure, 14 in a million, is that eligibility, or is it just those are the numbers of people who come forward? Like, it's so rare for somebody to come and put themselves out there.
That's the rate, the donation rate in Canada. So
14 in a million.
14 in a million. Yeah.
We'd like to see that get up to 16 or 18
We'd
or
like
more.
to see it get a lot higher than that. Absolutely.
What would be a barrier to an organization to do this? Or maybe I'm just throwing that question out because you have to ask that question.
I think education on it, truly. I mean, any of the organizations I've directly spoken to and informed about what is involved have joined on or are in the process of joining on. So it's whether they think it's resource heavy just in writing the policy. I mean, there's some, if you have union involvement, there might be some policies that would have to go through collective agreement processes, but I don't really see any reason why any organization wouldn't.
So we referred earlier to the Circle of Excellence. Within that group, would there be resources that you as an employer could reach out to and say, okay, we're looking at adopting this. Can you help us work our way through this process?
Absolutely. If you go to the AST Living Donor Circle of Excellence site, it links to many. You can reach out directly to them.
What is the AST?
That's the American Society for Transplantation. Like I said, it's in partnership with Canadian Society, but I think they've centralized all the information to the AST or American Society website rather than the CST. But if you simply Google AST Living Donor Circle of Excellence, you'll get directed to that.
Well, I want to thank you for, number one, your personal donations, but number two, what you've done moving your own company forward. Your past employers, I guess, as well, you brought them along, and now you're bringing so many others. You've turned out to be quite a shining light and a wonderful example of people who are generous and care about others.
Thank you, Stu. I really appreciate that. And I'm hoping, like I said, we get some traction with the Circle and other employers see this and recognize that something that they should do.
Yeah, I think it's a really important initiative because the benefits to society are massive at very little or almost no cost. And that's why when the opportunity came our way to participate, we jumped at it because it's a bit of a no-brainer. Removing that barrier to transplants, that financial barrier for someone who wants to be a donor, be a hero, but can't afford to take the time off work or make that financial sacrifice, well, it's where the company can step in to take care of that and remove that barrier, that limit that otherwise might prevent someone from going ahead. Signing up and being a part of this program was simply a piece of cake. Usually when asks come our way, there's an immediate ask, there's a direct ask financially otherwise, and this is something that lays the groundwork and the opportunity for support in the future, but doesn't necessarily require an immediate commitment. And it shows beyond just the financial, it says that the company is behind, in macro, this initiative and what what living donations mean to the society as a whole.